Dr. Cruz, sometimes people ask how long orthodontic treatment will take. Why does it sometimes take longer than you expect?
There are a number of reasons. Maybe I can go over the top 4 or 5, and not all of those reasons are the patient's fault or the doctor's fault, by the way. So, y when you think about how teeth move, one of the things to kind of factor is how dense a patient's bone is, and everybody is different. And so some patients will have incredibly dense bone, and you can imagine trying to move teeth through that bone can take longer. And so that's one aspect, although doesn't happen a lot. That's probably a top 4 or 5 reason. And then we start to get into the sort of the more common reasons. One of them is patients don't come to their appointments. And so you need to make
Oh,
sure that you obviously show up to your appointment.
sure.
Otherwise, things are going to start to get behind. Another one is compliance with something that we ask a patient to do. So, wearing elastics is a very common one. Back in my day, I actually had to wear headgear a long, long time ago. And so,
Really?
compliance with headgear is obviously not the best. Obviously, those days are done. That ship has sailed. People don't wear headgear anymore, at least not in my office. But compliance is a big one. And then the other thing to kind of factor in too is breakage. So what can happen is patients may have something that breaks, whether it's a wire or a bracket that comes off. And that's not uncommon. I don't want to give the impression that, oh my gosh, if you break a bracket, you're so in trouble, you did something horribly wrong. These things
Yeah.
can happen. But for those few patients that we have that get significantly behind on treatment, what will happen is that they will break a bracket and then not notify us that they have a broken bracket. And so it's
Oh,
sort of then a double whammy because then when the patient comes in, we didn't realize that a tooth was moving the wrong direction for the last month or two. And that's obviously going to add treatment to be able to get the tooth back to where it's supposed to be. And so I know, Rich, you and I have actually talked about this in the past. What we've done in our office to completely resolve that issue is dental monitoring. And so, all of our
yes.
patients have a scan box. And so sometimes our patients don't know that they have something broken. And so the scan box will be able to help us identify if something is broken, whether the patient knows it or not. So that's
That's
helped us a
interesting.
ton.
Sometimes they don't even know that it's broken.
Yes. The most common reason why patients don't know that they have a broken bracket is there's something we call it power chain. Sometimes it's called C chain. And you'll see this in patients where you have braces on, and then you'll have a color elastic that goes around all of the brackets to close space. That
Yes.
really kind of solidifies everything. And so if there's a broken bracket, it doesn't have the ability to kind of wiggle, which usually notifies the patient that, uh-oh,
Sure.
I have something broken. And so they don't know it, but the AI with dental monitoring is so good that it can tell even these tiny little subtleties and identify that there's something broken. And so, yeah, that's the point. Is that it's not necessarily the patient's fault. Sometimes that they didn't call us; they didn't know.
Absolutely. All right. So, how important is patient compliance during treatment?
It's huge, and so we've we as orthodontists are always trying to find ways to minimize compliance because, I get it. Life is busy, whether it's school or work or athletics and all of these things that you have going on in your life. When I try and then sprinkle on these other things that you have to do for me 20 hours a day, every day for potentially months on end, it's a lot. And so I feel like over the last decade or two, we've gotten a lot better at coming up with ways that reduce compliance. But with that being said, there are still situations where we need the patient's help. Um, and so there are some things that we do to help with that. For example, oftentimes the part of treatment that requires the most compliance, we used to do in the middle or the end of treatment. Let's take elastics, for example. Now
Yes.
we've realized that if we do that in the very beginning of treatment and we get the teeth set and the bite set where it's supposed to be, if we do that in the beginning, that is absolutely huge as far as being able to stay on track. And the reason why I say that is that patients are highly motivated in the beginning. They're excited. They want to see progress. And so the best time to kind of piggyback compliance is when you have that excitement. The other way of sort of thinking about it too is that we're not able to put the braces on and start straightening the teeth until we get the bite set. And so a patient has an additional motivation to be able to wear these elastics so that they can then get to the second step and get the braces on. And so that has changed things dramatically for us. We probably started doing that about 5 years ago, in getting the bite set and then putting the braces on.
Are there any specific habits that can affect orthodontic progress?
There are a few. The one big one that will kind of sneak up on us as orthodontists is what the tongue is doing. And so we kind of
Mm,
joke about this because patients aren't expecting me to talk about their tongue, but sometimes what can happen is patients will have either a tongue thrust or forward tongue posture. And you can imagine that if the tongue is behind the teeth and pushing on those teeth, it will oftentimes cause the bite to want to open up. And so you can dramatically negatively affect the bite. So oftentimes we have to kind of educate our patients as to what their tongue is doing. And then we come up with ways to be able to train the tongue to get back, stay out of the way so that we can close the bite down and get it where it's supposed to be. Another good example of compliance that isn't quite so obvious is hygiene, is brushing and flossing. And so, yes, of course, you want to keep your teeth clean so that you don't have marks on your teeth, so that you don't develop cavities. Those reasons are obvious. But the thing to also remember is that if you're not brushing and flossing well, the gums will become inflamed and thicker, and it becomes harder and harder to move teeth in an environment where you've got really thick inflamed gums. And so compliance with
yes.
brushing really does affect whether or not you can stay on track with regards to the timeline.
What about missed appointments? Let's talk a little bit more about that. We've mentioned it. How does that affect treatment?
It really does make a big difference, and maybe patients don't understand this, especially when it comes to, let's say, braces, for example. Oftentimes when patients come in, they oftentimes will refer to it as my braces are being tightened. And so what that means is that we're taking smaller wires out of the brackets and putting larger wires in. And that's that tightening feeling that patients are experiencing. And so if you miss an appointment, you basically have lighter, thinner wires that really aren't doing much. And the only way for us to then start to make progress again is for you to come in and come in for that adjustment and put the larger wires in. So yeah, missing appointments can definitely be a big one.
And didn't let me know if I'm wrong about this, but now that you have dental monitoring, aren't the appointments even more important? Because don't orthodontists who don't have it just put someone on a very routine schedule, and sometimes there is like an appointment that really nothing happens, but that's not really true for you, right?
Yep, you nailed it. That's exactly right. And so the way that it used to be maybe 15 years ago is that you'd see patients about every 4 weeks. And so, it's kind of exhausting on families to have to make a trip to the orthodontist every single month.
Yeah.
And then our technology with regards to braces and aligners started to improve, and we were able to get that to 7 or 8 weeks per adjustment or appointment, which was better. And now with dental monitoring, it really is customized to having the patient come in when it makes sense for the patient to come in. And so, depending on what phase of treatment you're in, we may need to see you every 2 months or we may need to see you every 4 months. It really depends on what we're doing. And so, the only way to be able to know when it's appropriate for the patient to come in is to be able to monitor them with these weekly scans that they're doing. Um, the other thing that is a little bit unique in our office is that prior to a patient coming into their appointment, I'll really sit down and take the time to look at exactly where they're at and exactly what should be done at that appointment, really customizing and detailing what that appointment should look like for them. And so that's why it's, important for our patients to do their scans so that I have something recent to be able to look at so that when they come in, we know what the wire size is going to be. We know whether or not they have to wear elastics or not. Can they stop
Mhm.
turning their expander? The list sort of goes on and on as far as the questions that you'd like to be able to answer. And sometimes that's really hard to do that on the fly when a patient comes in, you haven't seen them for a couple of months. You're doing the best that you can to assess in a couple of minutes where they're at and what needs to be done, as opposed to the way that we do it, where I'll in a quiet room at home, I'll review these scans and really take the time to figure out exactly what needs to be done. without kind of the chaos or distractions that can happen in, a typical work environment.
Yeah, I really think that differentiates you because you've shown me this process and you really do take the time to look at all of the data and prepare so that when the actual appointment happens, everyone knows exactly what to do and it's streamlined. It's pretty awesome.
I try not to I try not to be so, like, blatant about it and, like, brag about it because, I think it would just come off the wrong way of like, "Do you know how much time that I'm spending trying to prepare for your appointment?" It just it and so a lot of it is just sort of behind the scenes and happening, and so there are days where I feel like I want this, kind of acknowledgement of like, I'm spending all of this time,
Sure.
to try and do the best that I can. But then at the same time, I think, oh gosh, the patients don't want to hear that. They've got enough going on in their lives. It's like, look, do your job. Yes, we appreciate you. And so, yeah, I try not to bring it up too much.
Well, it's funny because, as a patient, I just assume all of that's happening. So to hear that it might not be is really that's the surprising part because I just take it for granted,
Right. Right. Yeah. Good
you know.
point.
All right, so braces versus aligners, can that affect the length of the treatment?
Let's talk about compliance again. And so, obviously the big difference between braces and aligners is one is removable and one is not. And so, yes, and it doesn't happen as often for us as it used to, but we would have real significant compliance issues. Usually, the trend that you would see for patients with aligners is that they're highly motivated. They wear the aligners really well. It's usually for about the first 5 to 6 months. They start seeing some benefit and then the motivation starts to wane just a bit. And so when that happens, the teeth stop tracking as well as they could. And eventually it gets to the point where the aligners really aren't fitting well at all. And so this was a really large problem for us for a long time, at least in our office it was, because I was trying to find ways to motivate patients, be a cheerleader, encourage them. What can I do to get you to wear these aligners? Because beyond that, I don't have much control. Whereas with braces, I have complete control over what we're going to do and making sure that it's constantly being applied to the teeth. And then I know I sound like a broken record, but that's where dental monitoring has come into play again. And we sort of joke about it, but because our patients now will scan their teeth every single week, they know that I'm watching. And so I sort of joke about it in this like big brother kind of way, but not trying to come off as some weird stalker. But I just say, hey, look,
Yeah,
every week I'm going to watch and see how well you're doing. And it's amazing the motivation goes up because they go, oh, okay, Dr. Cruz is going to see my scan. I need to make sure I'm wearing these aligners and I don't get in
absolutely.
trouble. And so our compliance with our aligner patients has gone through the roof. It's gotten so much
Really?
better as a result of this. And if I'm being totally candid, I didn't think that this was going to happen. This was an unintended benefit because I wanted to just more monitor patients' health and see how teeth were tracking, but I had no idea that compliance was going to go up. Yeah.
Wow. All right, for biological factors, we talked about bone density and inflammation. What other biological factors could affect the treatment time?
So we'll also have patients, some of our senior patients, sometimes people think that I just treat children and, we treat adults. We've had a patient, we've had a few patients in their mid 80s actually, which is, I think it's so cool. But the point to that is that sometimes as you get older, you will have what we call periodontal compromises. So for example, gum recession and bone loss. And so we're now treating a patient where you've got to be really careful as to how you move the teeth, how much force you put on the teeth, how quickly you're trying
Sure.
to move them. And so you want to provide excellent treatment and a great result, but you don't want to cause a patient to potentially, lose a tooth, for example. And
Yeah,
so the nice thing with something like aligners is you get to control the rate of movement and you can slow it down. And I'll explain this to the patients and just saying, this is going to take a little bit longer, but it's in your best interest that we do it this way. And so patients are completely on board, usually very grateful of like, hey, thanks for taking the time to explain that to me.
yeah, absolutely. All right, so what are other things patients can do to help keep the treatment on track?
I we talked a little bit about compliance and uh doing their scans is huge for our office. And I know there aren't a lot of offices, at least in San Diego, that do dental monitoring. And so, this doesn't really apply to a lot of other orthodontic offices. But for us, we want to make sure that once a week you're taking 2 minutes to do your scan. And so
Yeah.
it's funny, my youngest daughter had a great idea a few months ago. She's like, Dad, you should do some like Instagram videos of you like trying to find patients that aren't doing their scans. And so I th I think it was her way to make me do, like, unusual things and get a laugh out of it, so, for
Yeah.
example, she's like, "Dad, get in that trash can, and then I want you to hold the scan box, and you're gonna jump out of the trash can and pretend like you're looking for a patient." And so, sometimes I wonder if she was just tricking me into doing this to make me do these goofy things, yeah, and so we've got a whole collection of videos of me doing silly things with the scan box in my hand, and so we'll send those videos to patients that are starting to get a little bit delinquent with regards to doing their scans,
Yeah,
and
great
so,
idea.
we're trying to keep it lighthearted and trying to keep it fun, but yeah, if you do your scans and I can see where you're at, then I can provide, excellent treatment.
All right, so what advice would you give to someone who wants to finish their treatment as efficiently as possible?
It's all of those factors, so we can kind of do a recap of like, make sure you show up to your appointments, make sure that you're doing your scans, make sure that
Mhm.
you're brushing and flossing well. If I do have you wear some elastics, do a good job with wearing those elastics. So, there are those four or kind of five things. And when you add them all together, it can make a big difference. And Rich, I know that we've talked in the past about treatment times in general, where, when you and
Yes,
I were kids, 3 years was not uncommon. And, now we can provide treatment in, on average, a year and a half is pretty typical. And so about half the amount of time that it used to take. And so those things that we've talked about today, if you can do all of those things, there's a really good chance that, yeah, we can be done in, a year and a half.
that's amazing. Yeah, I'm about to finish my treatment, can't wait.
Nice. Yeah.
All right, that does it. We'll see you on the next episode.
See ya.